Good evening, everyone. I'm Dr. Basil Considine, and I'm here from the ACU Online Writing Center. And today we're going to be doing a webinar called Writing as a Nurse, Evidence-Based Practice. We're now well into the term, so you're probably familiar with the Writing Center services. But if not, in brief, we work with students at any stage of the process. All of our services are completely free to you. You can work with us through asynchronous appointments where you schedule a time. By that time, you upload your paper and put any special requests for feedback, and then we send you feedback by email, generally within 24 hours. You can also request a real-time appointment via phone or Zoom. Just send us an email to onlinewritingcenter@acu.edu with a list of potential times where you're available, and we'll try and match you up with our team. If you are asking most weeks of the term, this shouldn't be a problem. If you're asking during week 7, when everyone's rushing to get their final papers in for feedback, it might be harder to do. So generally week 0 through week 6, we can fit you in if you ask far enough in advance. And we also have a wide variety of resources at the Online Writing Center website, including links to all the recordings of our past webinars. We have a great deal of webinars. We offer a large new set every term. You can see those that we have left in the current term. Right after this, we have EDD in progress, strengths and self-analysis. Next week, we have another item in our Writing as a Nurse series where we talk about theoretical frameworks. A theoretical framework is a guiding theory or theories that strongly inform one's work or investigation or project. For example, if you are using the famous hierarchy of needs as the basis for an inquiry, if we're looking at the underlying theory for that rather than the model itself, then yeah, we'd have a theoretical framework. If we're taking the model as the central conceit that there's this hierarchy of things that determines what you can constructively work on. Now, you have to feed people before you can really get to the question of what makes them happy, because hunger tends to trump that. Then we would be working with the conceptual framework. Either way, we're going to be talking about how to implement those in practice, how to write about them, and other things like that. We have a number of other webinars coming up, of which if you're attending this one, you're probably also interested in the methodology paper webinar on June 8th. Now, each of these webinars happens to tie in with a particular course assignment. There may be principles that align with other ones as well, but we try and always ground the presentations by looking at a specific assignment and what you might do there. And if you look at the list of Writing as a Nurse webinars that are already available on the Writing Center website, you'll see that we have pointed out those tie-ins for you. So if you are in Nursing 647, hopefully you saw our medication errors and administrative reports webinar earlier. And you can always bookmark these things for classes that you take next, or check back because we're constantly adding to this series. All right, let's delve into our main purpose today. We're going to focus on 2 things: how to write about evidence-based practice in APA style, and the expectations for Nursing 647's week 3 assignment number 1, depression and suicide. You can probably guess from the title of that assignment that we're going to be talking about the potential trigger warning topics. So just be forewarned there. This is something that unfortunately affects several tens of thousands of people in the United States every year and their families and loved ones. So it is something that does come up on the job. All right, so let's talk about writing about evidence-based practice in APA style. Well, let's start with that question of what is evidence-based practice? And I'm going to refer you to Barbara Wilson and Mary Jean Austria's excellent definition. Evidence-based practice is applying or translating research findings in our daily patient care practices and clinical decision-making. EBP also involves integrating the best available evidence with clinical knowledge and expertise while considering patients' unique needs and personal preferences. If used consistently, optimal patient outcomes are more likely to be achieved. And if you're looking at a copy of the slide deck, you can click on that link and read the larger article where they discuss this So evidence-based practice comes up in a lot of our assignments and ultimately in the DNP project that you complete at the end of the BSN to DNP and DNP programs, because we want practice as a nurse to be informed by the best, most current knowledge that's out there, to make sure we're not doing things just because it's tradition or just because someone had a hunch, but that there's actual data backing that up, saying, yes, if we do this, things will be better for patients, this will be better for saving money, whatever those particular pieces of evidence might be. So there are 6 tenets of evidence-based practice that you will often see cited. Sometimes you'll find a list of 5, but 6 is, in my experience, the most common. And the first is to say that evidence-based practice starts with asking a current question. Not something like, well, you know, what was Florence Nightingale dealing with in the Crimean War? Something about today, what's facing nurses, for example, in the United States or in the state of Texas. And there are lots of things that are coming up, some of which have been asked before, but are still current. They're still applicable to the present, and so that's a current question. Acquire the current evidence. So there are lots of things that you can learn by doing a retrospective study. But if we're doing a retrospective study of the 19th century and data from there, you know, that's more than 120 years old at this point. A lot of things have changed. So we want to make sure that you are getting current evidence. If you attend one of our earlier webinars where we talk about, you know, big data, you can see some ways to find that kind of evidence without having to go to your own institution and ask for records and things like that. But make sure that you get that you acquire current evidence. Appraise the literature. So appraise rather than read the literature. So reading is great, but appraising is when you examine it, where you ask questions like, is this applicable to my context? Is this population that they studied similar enough that we think that there is a strong likelihood of getting meaningful results here, things like that. And you don't want to just evaluate it. I might ask, you know, in this day and age, knowing past biases in, for example, tobacco company sponsored research, just because a article comes out that comes up with findings and conclusions doesn't mean that we don't look at it critically. If we want to see, okay, are there any potential biases here? How does this align with or not align with other, hopefully less biased research? And applying the findings to clinical decision-making. So this is a very important one. We're not just going on a thought exercise. Evidence-based practice is taking these things based on the evidence, informed, guided, etc., and saying, okay, we want to make sure that the decisions about what's happening at the clinical level are informed by that. And that we don't just say, okay, well, that was recommended, so we did it, but to evaluate the outcomes to see, is there a way of testing that this is the case? Now, a classic way that this comes up, and that comes up in many people's DMP project, is with a pre-post test design. A pre-post test design is usually used when you have some sort of intervention, like an educational thing. Let's say you are working at a healthcare facility that has problems with antibiotic-resistant bacteria, you know, MRSA, that kind of stuff. And you say, okay, well, we're having issues here. We had 6 patients who had their care extended, possibly dealing with hospital-acquired infections. So you say, all right, we're going to examine the literature. We're going to find out what the best practices for this are, and then we're going to have an intervention. And the evaluate outcomes to say, okay, well, so we're calling everyone and they're doing a training. That's our intervention. But to test that the training has been effective, we're going to have people fill out this assessment or survey beforehand and then afterwards. Or in some cases, they'll do more milestones. They'll have before, immediately after, and then a month later to see, have people remembered this? Have they forgotten them and gone back to the old ways? So that's all about evaluating the outcomes. And then disseminating the results. So this is a key thing. And one of the reasons you don't see this one on the list sometimes is that if you are just working in a local facility, it is easy to say, well, okay, we tested things and our main goal was just fixing things internally and making sure that this is working correctly. Well, the sixth tenet of disseminating the results is saying, well, we shouldn't keep these a secret. We should publish them and make this scholarship, make this findings, make the knowledge about how we did this intervention, make this available to the public so that other people will be able to put them into practice. And ultimately, more patients besides those in our direct care will benefit from improved outcomes. Here's a flowchart from Hewitt and Macmillan showing different steps in the process. You can see that it's not always linear. Sometimes you go from step 3 and you go back to step 1. You say, okay, well, we looked at that and we find that actually that wasn't as clear as we thought. We needed more information. So we go back to collecting more internal data. And then once that's done, now we can appraise. And this happens sometimes, especially when you're doing a thing that requires access to patient data, and you might go and request some things. Say, well, okay, we got the summaries, but actually it turns out we need the detailed charts. So you go back and you request the IRB, hey, can we get access to this? And then you get the new data and then you reassess and then you move forward. It could be, all right, we're going to do more research on that. Now that we have this additional data, we need to know how to understand it, or you might be able to move straight through into step 4. Now, one of the things you'll notice in this flowchart is that the labels don't exactly correspond to the previous list. So for example, disseminate the results here. You can understand that with the bullet, recommend broader changes. So broader changes in not just for the immediate context, but we're trying to have a larger impact. And sometimes that's going to be disseminating to the whole institution or network. And sometimes it's going ahead and publishing a scholarly article. When you are evaluating evidence to inform your practice, or in other words, trying to develop evidence-based practice, it's helpful to keep in mind that there are different levels and types of evidence. And at the highest, this is the gold standard, we have randomized control trials where we get people coming in and we randomly assign them, okay, you're getting the vaccine, you're getting the placebo, and then you track the outcomes and such. So randomized controlled trials are great. They also tend to take a while and be expensive to conduct because you have to follow all these people and assess things and collect lots of data, sometimes from a dispersed geographical area. So as you are probably well aware from the vaccine trials that recently completed that led to teenagers being recommended to get various COVID-19 vaccines, RCTs take a while and they often proceed in different stages. We are in a period where we are seeing this play out where they did the trial with adults first, then they did the trial with teenagers concluded after they felt that they could even start that because the results for the adults were promising. And now we're working with smaller children in a trial, and we'll see if it ends up being the level where they give infants these vaccines, or if they determine from the evidence that they have to wait a little bit for the immune system to be a little more developed and more responsive. I'm curious to see what will come out, because a lot of that, how young can you give someone a vaccine, it can differ based on the vector, the other allergens that are included in it, and other stuff like that. So now RCTs are the gold standard, but sometimes you don't have quite that level of resources, but you've got a lot. So doing something like a cohort study or an observational study is good. Less easy to generalize because you don't have the data in a very accessible and say, okay, it was collected under these specific circumstances and things like that. Expert opinions that are supported by various types of evidence, experience, studies, reports, and at the least weighty, personal experience. Now, this isn't to say that personal experience doesn't have a role to play, but usually personal experience and expert opinions are what we call instigating factors. You look at those and say, okay, well, I've seen this happen, or so-and-so says this, so-and-so recommends that. And then you go in and you go to validate it with level 2, with a cohort study, a case control study, or an observational study. And based on the results there and the apparent need and reward, then you go on to do the very expensive randomized controlled trial. If you have the resources, and again, there is that pressing need. So RCTs are preferred. Will you find an RCT that's being done or done on a similar population? Depends on the issue. And as we're seeing with the COVID-19 vaccinations, this is something that is sometimes an evolving thing with a moving target. Well, okay, we saw with this population, but will it work with these people who are younger, or these people who have these other different demographics? So here's an example of a trial, and the trial is called Effectiveness of Long-Term Oxygen Therapy in Treating People with Chronic Obstructive Pulmonary Disease with Moderate Desaturation. So a short version, you have people with COPD, but it's only moderate. Does giving them pure oxygen and help them in a noticeably measurable way? So this was measured in 2 basic functions. How long did they live after they entered the trial? And then how long did it take before they got hospitalized because they had breathing problems? Now, this was following up on studies from the 1970s that showed that patients with severe COPD who were given an long-term oxygen therapy, they come and get supplemental oxygen and they take it home and have it all the time, that they actually had a significant increase in their lifespan and a lengthened time before that first hospitalization for breathing problems. So this particular trial ran for 6.5 years. It collected data from 738 patients, and it found no statistically significant difference in the dependent variables. And looking at okay, well, were they hospitalized and how long was that from when they began this? And how long did they live? And very importantly, there was no statistically significant difference, but from other things they're tracking, they realized that, 7% of participants receiving supplemental oxygen also suffered severe side effects. And if you're wondering what happens with that, well, usually these are people who are somewhat elderly, and the side effects included tripping over the equipment and falling, which is bad when you're at that age and you're breaking bones because of it. And also some of them had fires because you have pure oxygen involved, and unfortunately did not always have the best discipline around them for open flames. So yeah, there were some significant side effects. Now, why was this necessary? Well, there was that earlier set of studies that showed that patients with severe COPD did better. So it was natural to think, well, they might work with people with more moderate COPD. But it turned out from doing the trial that there was not a statistically significant difference. Yeah, a couple people, a little bit longer, but not anything to write home about. And the fact that 1 in 14 people had severe side effects. We're not even talking the minor things, but like they fell and broke bones, or there was a fire and they were burned. That is large enough to look with caution on rolling that up more broadly. So what would this mean for evidence-based practice? Well, if you had a patient who came in with moderate COPD, based on this, you probably don't want to give them long-term oxygen therapy unless there's some complicating things, or they're having a very fast decrease in their ability to absorb oxygen through the lungs. in which case you say, okay, we see the trajectory, we're trying to head this off so that they don't go to the hospital immediately. We can kind of delay that a little bit. But in general, moderate COPD, don't give them long-term oxygen therapy based on the results of this. So while the evidence-based practice for people with severe COPD is, oh, give them long-term oxygen therapy, it's not for this more moderately affected population. All right, some suggestions about how to write about evidence-based practice. Well, cite your sources of evidence and make it clear where the data is coming from. When you are comparing conflicting results, and these come up a fair bit, you can think of some involving COVID-19 treatments that came up in the last year. Okay, when comparing conflicting results, check for sampling or population discrepancies. It's no surprise that some things work better for some groups than others, but what exactly those are, that can be tricky. So, for example, you have some foods that can significantly affect the absorption of sugar. Cinnamon, for example, can have a moderating effect that seems to protect the body against blood sugar level spikes. So if you are testing something in an area where people have a high level of, pardon me. Okay, let's redo that last bit just to make sure we got it with the Zoom connectivity thing. So when you are writing about evidence-based practice, here are some suggestions. Clearly cite your sources of evidence. Tell us what the data you're using or the analysis or the recommendations you're using to make your decision. Cite those sources. If you're comparing conflicting results, make sure you check for things like the sampling method or the population studied for any discrepancies. It's probably no surprise that there are some significant differences that exist in the general population, depending on bands, and the fact that a lot of psychology research, for example, tends to be conducted at college campuses where you have a high proportion of 20-somethings. You may get significant skewing one way or another. I have been at some colleges where about a quarter of the population was Asian, and some where about 1% was, and that will skew your data in some ways. Certainly skew some things like the height. Or you might have something where you have a population, and a lot of studies were done in the military in the 1950s when that was basically all men. And so unsurprisingly, when you have some drugs that are related in some way to sex hormones like estrogen and testosterone, you might get a different result with all those men versus if you had a population composed of women or a mixed gender population. When you are applying your evidence-based practice to a workplace or organizational context or clinical site, make sure that you assess what the status quo is and how that compares to whatever current research suggests for the practice. Because you might be that you have something that has been done for a while, but is out of sync with current practice. And that's one of those things where saying, oh, we've noticed that this isn't the case. That's a good reason to check and say, will this do better than this thing that we've been doing? We also want to identify any practical barriers to implementation, because there are many things that you can do with a great deal of resources that you might elect not to because, well, it costs a lot of money, or we need more staffing, or the staff are just overworked with other things they have to do. So there may be cases where you do a partial implementation, or where you decide to ultimately not implement something because it's impractical under current conditions. All right, at this point, we are going to zoom in on the assignment. So as I mentioned, this is a potential trigger topic. So this is for Nursing 647, Advanced Pharmacology, Depression and Suicide, the week 3 assignment 1. So this assignment asks you to watch a video. The video has a whole series of anecdotes and discussions about 3 patients. And we have the task of looking at it from the perspective of risk assessment and suicide prevention. So for this assignment, students will complete the following. They'll identify a tool for assessing suicide risk from the listed resources, or using a resource that you identify that you can use at your facility. And you should be doing this by applying that tool. I'm sorry, that came out wrong. You need to identify a tool for assessing suicide risk from the resources that are provided, or one that you're already using at your facility, and to complete the tool to basically apply it to the person in each of those 3 case scenarios. You need to include the specific tool, if it's called an assessment, then the assessment as an appendix at the end of the assignment. When you're discussing each of the 3 case scenarios, you want to list the signs and symptoms of depression that can be observed, and then suggest creative clinical practice initiatives for quality healthcare delivery and improving these patients' health outcomes. And then you also need to describe the role of healthcare leaders with suicide prevention. What can they be doing? What should they be doing? And that can be both general and specific to your facility. So the paper length is not that long. We have 2 to 4 pages, so that's roughly 500 to 1,000 words. You are only required to cite a couple sources, but they should be recent, less than 5 years old, being the definition applied here. And again, you need to include that tool that's not counting towards the required page or word count. And like all assignments in APA style, we want to use in-text citations and have a reference page for the sources being cited. If we look at the rubric, it is basically laying out those things. We have 4 main content areas here that each get 20% of the credit for the assignment. So want to make sure they're all done and done in detail. And the other 20% comes from following the instructions for the length, APA style, and making sure that you have those citations and references with recent sources. All right. So because this video is referenced, you're probably going to be mentioning it in this paper because you have to dissect the 3 instances. So there's some information that we need for our reference. First, we need the author. For a YouTube video, this is the channel name, which in this case is BBC3. If you're wondering what BBC3 is, if you go to the UK on a television set, this would be the 3rd station. And it's BBC, the British Broadcasting Corporation's 3rd station. So that's why it's BBC3. They've just named their YouTube channel after the television channel. All right, we also need when it was published, which for a YouTube video means we need the year, the month, and the day in that order. And you can see that the date is here on the YouTube page, November 12th, 2017. And so we just rearrange that into the order I mentioned a moment ago, 2017, November 12th. All right, so what's the title here? Well, in this case, we have a more or less a title and a subtitle, Student Suicide, Real Stories. Now, this is written in title case on the YouTube page, but as you probably recall, a title of a book or a video or an article in your reference list is rendered in sentence case, which is why we want to capitalize the S in student, but not in suicide, and the R in real, but not the S in stories. That square bracket note saying video, that is something that you do to indicate that this is a video. YouTube is the platform it's on, and then you include a link. Now, you can, and just to click on the link in the course website and you'll get a long link. But if you click on the share button, you'll get the shorter link that you see here, which just looks more elegant and neater. All right. Now, what happens if you need another source, or you're trying to find out where something that you were given for the course, where that was published? Well, in that case, you'd go ahead and head on to the ACU Library. And in fact, I think we have time to spend a little time on that. So if you head on over to the ACU Library page, you will find that there, first of all, if you haven't been there in a term, you'll see that we have a spiffy new design. And second of all, you'll find that all the search methods are exactly the same as they used to be. All right, so I'm going to go ahead and share my web browser screen here. And you'll see that we have a lovely picture of the library building on campus. So if you haven't been to campus, it looks pretty nice right now. All right, so let's say that we were looking for a resource. Now, for this assignment, you may find that you have one at your facility, but you notice, oh, this was published, but I'm not sure what it's called. And so you could put in whatever information you have, the title, the author, and try and find that. We're going to do a search here. And let's say that you were looking for a depression inventory. And you'd get some results coming up. It's probably going to be far more than anyone wants to read through. 875,000. Yeah, that's a lot. Well, we want to only get things that we can actually look at. So we'll select full text there. And we also want this to be a peer-reviewed scholarly journal article. So I'll hit that second checkbox. And in addition, we want it to be recent. So I'm going to go ahead and I'm going to put in 2017 to 2021. You'll see that this reduces the number of sources by a good amount. We still have 127,000, so we're not exactly worried that we're leaving out a lot of literature. There's going to be very hard for someone to read all these. So you be even more specific and see how directly you can get literature that aligns with their context. All right, well, let's say that we said, okay, well, we want to now look for stuff on suicide assessment. And you'll find that it carries over those things that we've already selected about full text and scholarly peer-reviewed articles and publication years. And we see, oh, we have a lot of results here. Can we get even more specific? What if, say, we were looking for something involving college students? You can also throw in things like the geographic context. All right, now this one here is a pilot study. Pilot studies are not bad, but ideally you'd have something that had been validated more. All right, and so this one you see is among Nigerian university students. So perhaps you want to specify, you want to look at things in the United States only. So you could add that as one of your search strips. Either way, whatever you select, I would recommend that you click through to the article, because while there's nothing stopping you from going to the full text, we have in our ACU Library database the abstracts available. So you can look at it and see, does this align with what you're looking for? And we see, oh, about American college students. All right, check one. And then go through and see, does this seem to match what you're looking for? If that it does, you can go ahead and use the Cite button and go ahead and under APA, we have the reference here. You always want to check to make sure that these are formatted correctly, and this looks perfect. So you could just copy and paste it into a Word document. Okay, great. And then you can go ahead and open up the article. By the way, if you are doing an assignment where you need a permalink, this will work here. You can copy that. All right, so let's go back to our slides now. So one of the places that students often go astray with an assignment like this is they'll start free writing and then they'll run out of space. Now, as it happens, this assignment, you have 2 to 4 pages, so that's not looking for a ton of extra detail. It's one of those give the instructor exactly what they ask for kinds of things. And you'll find that the instructions actually very logically divide this into a few areas. So you'll notice here that there are 5 bullet points. The second one is about having that appendix. All right. So excluding that, you've got 4 bullet points to put in. So when you're outlining it, you say, okay, the first section, I'm going to identify the tool and state why that was selected. Then number 2, you're going to describe before you finish that section, you're going to go through each of the 3 case scenarios applying the tool. So say, report back, okay, according to this tool, they have X symptoms. They present with these things. Then in your second section, you'll describe the signs and symptoms of depression seen in each in more detail. And then the third section, you're going to suggest creative clinical practice initiatives to improve the healthcare delivery and improve these patients' health outcomes. Okay, what could a clinician do? Because some of those things in the video, you see that they're warning signs. And if someone already has an encounter with the care provider, how might that be improved? How it might have been routed, that sort of thing. And then the final main section, describing the role of healthcare leaders with suicide prevention. So let's go back and look at that outline slide. Well, of course, you're going to introduce the issue that you're going to be talking about. And of course, you want to have an outline of the major sections or content that you discuss in the paper. Then we have those 4 sections. And so that we were just talking about, a conclusion, references, and then the appendix, where you have the tool itself. So keeping in mind that you are only writing 2 to 4 pages worth, if you write exactly what the instructor wants you to do, you're probably going to end up with around 3 or 4 pages as body content immediately. But if you end up a little on the short side and you're wondering, what kinds of things can you say in the conclusion? Well, it's good to think back about what this course's goal is, which, among other things, is that students will utilize concepts of advanced pharmacotherapeutic management and evidence-based treatment guidelines into nursing practice. So given the tool that you identified, given the symptoms and signs that you have marked down and used to fill out the tool, given those things, what can you do to apply pharmacotherapeutic management and evidence-based treatment to make the nursing practice better and informed by evidence? That's it for today. I hope that this webinar was helpful. I will stay around if you have questions for a little bit, but I encourage you to visit us for later webinars in our Writing as a Nurse series and to check out the recordings on our website.